Balance, the foundation of movement. From that magical moment when an infant transitions from crawling to walking, balance becomes the mobility-enabling tool of life. We use balance to achieve new heights of accomplishments in all aspects of our lives. Without the gift of balance, our experience of life would be very different. It's not until our mobility is lost that we realize what we have taken for granted. Balance loss can come from many sources. Unfortunately, there have been no viable solutions to correct balance loss until now.
Several years ago, while treating a client, I realized a very important intervention for patients. I began looking at clients to determine their directional instabilities and rotational asymmetries. I had this patient come with MS. Her name was Mary, and Mary actually has changed my life and the way I treat and everything about what I do. I realized that Mary had a certain directional loss of stability, and I placed these small weights, only 1.5 pounds, on her torso, and it completely changed her ability from walking completely poorly with bad balance to walking almost nearly normally. Improvement could take months, and yet I was seeing it in one day. That treatment with Mary changed how I treat, how I think, and now the motion I bring to Motion Therapeutics. It was the beginning of a new patented treatment technology called balance-based torso weighting. In that treatment, we determined the three-dimensional directional instabilities of a patient, including loss of balance forward or backwards, sideways, or even a rotation at the upper body or the lower body. And then based off of that assessment, we place these small weights strategically on the body as a counterbalancing technique to counterbalance every instability that the patient has. And as you're working with the client, you see them get more and more and more stable. Once they become stable with this treatment, they begin moving better right away, almost instantaneously. It seems unbelievable that it could be instantaneous, but it actually is.
My name's Brittany Bodie, and in 2006, I had a cavernous brain malformation in my brainstem.
My name is Joe, and several years ago, I had a double brain aneurysm.
When I came out of surgery, actually the left side of my body was extremely weak to the point where it looked like it was paralyzed, and I had extreme vision problems, so I couldn't move the left side of my body at all.
I had a problem with left side neglect, which meant that I could see things on my left side, but I would still run into them. My life had totally changed, and as far as I was concerned, I felt like that's the way things were going to be from that point on. Wearing the balance wear vest, it changed things significantly, and it gave me some hope, because I thought before I was going to remain in that condition for who knows how long, maybe forever.
With the weights on, I felt like I could run, and I could even run backwards, and at the beginning I could hardly even walk normally. And I just remember feeling like I'm finally normal again.
Now things had totally changed, and now I had a ray of hope in my life. Things were changing. Now I could envision myself doing some of the things that I had done before.
Motion Therapeutics produces the BalanceWear products that help patients improve every day and improve in their ability to move about.
The BalanceWear vest did make a significant difference. I'm looking forward to pursuing it further. I'm looking forward to working with the vest and actually keeping with the program.
Patients of all types with different diagnoses can be helped with BalanceWear. If they have a balance instability and we can find it in the assessment, often we can make the same-day change. It's really not about the diagnosis. It's really about the balance impairment, and if we can identify it, we can treat it.
I can walk much better. It's a blessing.
If you'd like to know more about BalanceWear, please contact us at motiontherapeutics.com. Thank you.